I am the coordinator for the Peer Resource Recovery Center in Warsaw, and it is a delight to be here. I work for the Northern Neck Community Service Board, which is located in the Northern Neck Middle Peninsula region. We serve 10 counties, and our center is operated by a grant. And we have one big department called the Office of Recovery Services, and Peer Support Services, and the Post Overdose Response Team. And my office is pretty much at the center, and it's like a hub, and we have everybody coming and going there. So today, this overall presentation is pretty much just an overall, just hopefully it is to inform you, just to give you a little more insight, awareness about mental health and substance use disorder or co-occurring. A little bio here. For me, I'm 20 years in recovery. I'm a person with lived experience, or another way to say it, I am a person in long-term recovery. And that was from alcoholism. I've been married for 17 years. A special education teacher I was for 11 years in the public schools. I have 5+ years as a supervisor experience in the recovery field as a peer resource coordinator at the Warsaw Recovery Support Center, CSB, Middle Peninsula and Northern Neck region, and a state trainer for the Certified Peer Recovery Specialist, personal medicine coach with Patricia Deegan Academy and Associates, and a master's from George Washington University, Education and Human Development. Have you ever heard of the Rat Park experiment? Just give me a little thumbs up. All right, I'm going to be showing a video in a couple of minutes about that, which is about the opposite of addiction is connection, which is by Johann Hari. Another little tidbit right here. I am a mother of 2 grown children. One of my children has a mental health challenge. Can you tell which one? The point is that it's hard to tell. Anybody, your neighbor, a family member, anyone, you just never know. And there's my husband, and that's our family when we took a trip to Europe. Been married for 17 years. I have a lot of wonderful support. And I just wanted to throw that in, how much my recovery means to me and how grateful I am. All right, so here is this video that I'm getting ready to show on the Rat Park. Now, this one is really interesting. It's a cool scientific video. And, some people may agree with it, some people may not, but it's just a little bit more of awareness about this experiment, and it is pretty interesting.
Almost everything we think we know about addiction is wrong. The idea of addiction we've all got in our heads, that story, comes partly from a series of experiments that were done earlier in the 20th century. You get a rat and you put it in a cage, and you give it 2 water bottles. One is just water, and the other is water laced with either heroin or cocaine. The rat will almost always prefer the drugged water, and almost always kill itself quite quickly. In the 70s, Bruce Alexander, professor of psychology in Vancouver, comes along and he looks at this experiment and he noticed something. He said, we're putting the rat in an empty cage. It's got nothing to do except use these drugs. Let's try something a bit different. So Professor Alexander built a cage that he called Rat Park, which is basically heaven for rats, right? They've got loads of cheese, they've got loads of coloured balls, they've got loads of tunnels. Crucially, they've got loads of friends, they can have loads of sex, and they've got both the water bottles, the normal water and the drugged water. But here's the fascinating thing. In Rat Park, they don't like the drugged water. They almost never use it. None of them ever use it compulsively. None of them ever overdose. You go from almost 100% overdose when they're isolated to 0% overdose when they have happy and connected lives. What if addiction isn't about your chemical hooks? What if addiction is about your cage? What if addiction is an adaptation to your environment? This has really significant implications. The most obvious implications are for the war on drugs, right? We punish addicts, we shame them, we give them criminal records, we We put barriers between them reconnecting. Now, there's a place that decided to do the exact opposite, and I went there to see how it worked. In the year 2000, Portugal had one of the worst drug problems in Europe. So one day, the Prime Minister and the leader of the opposition got together, set up a panel of scientists and doctors to figure out what would genuinely solve the problem. And they came back and they said, decriminalise all drugs, from cannabis to crack. But, and this is the crucial next step, take all the money we used to spend on cutting addicts off, on disconnecting them, and spend it instead on reconnecting them with the society. But the biggest thing they did was the complete opposite of what we do. A massive program of job creation for addicts and microloans for addicts to set up small businesses. And when I went and met the addicts in Portugal, it's fascinating. What they said is, as they rediscovered purpose, they rediscovered bonds and relationships with the wider society, and the results are in. Injecting drug use is down in Portugal, according to the British Journal of Criminology, by 50%. Overdose is massively down. HIV is massively down among addicts. Addiction in every study is significantly down. We talk all the time in addiction about individual recovery. And it's right to talk about that. But we need to talk much more about social recovery. We created a society where for a lot of us, life looks a whole lot more like that isolated cage and a whole lot less like Rat Park. What I try to do now, and I can't tell you I do it consistently and I can't tell you it's easy, is to say to the addicts in my life that I want to deepen the connection with them, to say to them, I love you, whether you're using or you're not, and if you need me, I'll come and sit with you, because I love you and I don't want you to be alone or to feel alone. And I think the core of that message, you're not alone, we love you, has to be at every level of how we respond to addicts, socially, politically, and individually. Because the opposite of addiction is not sobriety. The opposite of addiction is connection.
So that was just a little tidbit about the opposite of addiction is connection. This next one is really an interesting one as well. It's has a lot to do with sympathy versus empathy. And I would like to share that one as well.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. Yeah. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
Well, I have to say, I was that mom. Woo, you know, you want a sandwich? I was one of those that I didn't know what to do. I mean, I cannot understand sometimes, even though I'm in long-term recovery, how uh, what a panic attack is like, or just major depression, or hearing voices. I didn't understand a lot of things like that, but so when sometimes you might be in the fix it mode. So that is a perfect example of just kind of just being more mindful about sympathy and empathy. So whenever I try to catch myself, I think about that a little bit, especially for family members or anybody that might be going through some of this. This, like I said, I've certified recovery specialist training. This is the painting that, if you can see this, the one to the right is the one that I painted that is on the second floor of the Science Museum. And I just want to say thank you again for the opportunity. This is what helped me with my mental health as far as a family member. And this is just a part of what anybody could do if you have something that is what I would call personal medicine. As I mentioned before, there will be another video about that with Patricia Deegan, and that is what I would call personal medicine. And painting a picture was just one of them, and this was just demonstrating a perfect day, and I just wanted to capture that. All right, the video that I'd like to share is Patricia Deegan.
Very early into being in the hospital, literally within a day, I was diagnosed with schizophrenia, undifferentiated type, with paranoid features. And that became the diagnosis, and that diagnosis took on what I call a master status in terms of my identity. The fact that I was Pat, the fact that there were many aspects to who I was as a person became absolutely irrelevant once I held this label, this diagnosis. What mattered was that I was a quote-unquote schizophrenic. In other words, my humanity seemed to others to be quite secondary. So the fact that I had friends, the fact that I was a good athlete, none of this seemed to matter. It was like wearing a scarlet letter in big neon lights. This is a disease, not a person. This is a disorder, not a person. So he felt like he knew my future. He had read a generic textbook and simply applied it to the case in front of him. Schizophrenics don't recover, Pat Deegan won't recover. And it was that simple. And he urged me to go into a halfway house and to go on Social Security and to essentially retire from life. And then I remember having a thought, and I had never had this thought before, but the thought came to me, I'm going to become Dr. Deegan and change the mental health system so that no one ever gets hurt in it again. Wow, that thought had never come to me before. And yet, it held me with a power. It became for me what I call a survivor's mission. In my own understanding of it, I believe that I have been called by a power greater than myself to do the work that has become my life work. I do not tell that to psychiatrists or treatment teams when I meet them. Miss Deegan, if I had gone to the treatment team then, Miss Deegan, what is your goal for your treatment planning this year? Well, doctor, I have been called by God to change the mental health system so that no one ever gets hurt in it again. Delusions of grandeur. Up the haloperidol. So I kept this new dream, this new survivor's mission to myself. It became mine. It became something that around which I could organize my recovery. And I think that this is so important, that you can't organize a recovery around a vacuum. You can't organize recovery around nothingness. We need to organize our recovery around something that has meaning, something that has purpose, something that gives us a sense that I can begin to move. The driving belief in mental health centers that we will find better living through chemistry, we will find recovery in a pill. This is a myth. Swallowing pills does not make a recovery. You know, that those of us who are struggling with major mental disorders have a very different task in front of us than becoming good pill swallowers. Yes, medications can help, but medications can also prevent recovery, and of this we need to be very aware. From day one, giving people the message that recovery is about changing our lives, not changing our biochemistry.
Very important message. You know, I really love the way she talks about that, about not just being good pill swallowers, and that just not up in the Halidol and all that. So that is just really an important message, and that's the one that has that Dr. Patricia Deegan has the personal medicine curriculum. And a lot of us at our center have gone through that training, and we use that with our peer recovery specialist certifications. So talking a little bit more about evidence-based approaches for non-clinical, NAMI, which stands for National Alliance for Mental Illness, is backed by SAMHSA, Substance Use Abuse and Mental Health Services Administration. NAMI has families to family support groups and NAMI connections and a whole other array of, it's an advocacy group as well. And it's a wonderful resource. Peer support is also evidence-based. That's non-clinical, which is what we do at our center. And we have state certified peer recovery specialists. They go through a training, which they have to pass an exam with ethics under the Board of Counseling. And it's pretty rigorous. And it's just a wonderful way to show value in people with their lived experience as in recovery. ITC, that is a new program that is kind of a grassroots pilot program called Invitation to Change, using motivational interviewing skills combined with teaching understanding with compassion to loved ones and to family members. That is wonderful just to have for family members or just the community or even faith-based community. It's just pretty much talking about how behaviors make sense and that one size doesn't fit all. Ambivalence is normal, using communication tools. And basically just starting with the awareness and then moving more to the understanding and then action. Most people, when they're in a crisis, they're just mainly wanting to move directly to action. But this approach is pretty much, NAMI has a lot of support groups and everything, but the ITC, Invitation to Change, has more strategies. The evidence-based approaches for the clinical side is, some of these you might already know, are cognitive behavioral therapy, coordinated specialty care, CSC, which specifically focuses on providing comprehensive evidence-based treatment to young people, CSC programs that introduce these evidence-based components over a 2 to 3 period following a first episode of psychosis have been shown to have beneficial effects on outcomes over time. In other words, catching it early. For young people experiencing first episode psychosis, reducing or stopping substance misuse yields significant improvements in psychotic symptoms and depressive symptoms, and can improve a young person's ability to get back to his or her life. Research has found that young people who stop using substances after a first episode of psychosis achieve outcomes similar to those who had never used substances. That is a very interesting point. So the earlier, the better. Overall, reducing or stopping substance use early in the experience of psychosis predicts better long-term outcomes. So, how can you help if you are a provider? If there are any doctors out there, providers, the Home Virginia Department of Behavioral Health Developmental Services is a resource. Knowing different therapists, doctors with a list of these therapists can help if you do not specialize in mental health or substance use disorder. Being able to call or refer a person for additional help is a start. The need is great out there, and the resources are the answers, along with an open mind about recovery. So right here are just some further evidence-based articles for reading, like the counselor training and several evidence-based psychosis addiction treatment in private U.S. substance abuse treatment centers. There's the research corner roundup, and then it just shows you, this is just kind of like a little rundown of how you could sign up for that, and the newsletter is an opt-in feature, and the upcoming trainings and events, that's what it would show, and for families and loved ones and professionals. I think I'll just go ahead and just talk a little bit about some of the takeaways. I've given, I think, enough of the mental health and substance use disorder, and just to let everyone know, of course, it can be co-occurring. But rather than focusing on the diagnosis, recovery can happen with a combination of factors. The lecture is focused on different types of processes, whether clinical or non-clinical in nature, that recovery comes in a multifaceted way. As a peer recovery specialist, a parent, and a family member, and coordinator of the Warsaw Recovery Support Center, we get to use a lot of our certifications and trainings in our workshops and classes. In addition, we work with the clinical side as partners so that a collaborative, evidence-based approach is maintained in helping individuals with their recovery. So I'd like to give a little quote from Becky Grazer. She's on the board with the commissioner for the Department of Behavioral Health Department Services. She's also my supervisor. And I didn't get a chance to say everything I wanted to when I was on the radio in our local station, because they only gave us 2 minutes. So her quote is, "We want to emphasize the organic nature of why these centers like ours are effective in reaching the people in recovery for both mental health and substance use or SUD disorder. Build it and they will come." That has been our philosophy, and they have come. Our peer recovery centers are located in familiar neighborhoods, which are central to the population we serve. The centers provide a safe, informal, and non-judgmental environments, which often attract in the pre-contemplative stage of change, as well as those in the contemplative stage and action stages. They meet, they chat, and they get to know each other. This mixing or blending of people at different levels of recovery, which takes place naturally in our centers, is the type of exchange we most hope to foster. It often takes place without fanfare or even recognition on the part of those experiencing each other's recovery. But it is perhaps the most subtle and yet powerful phenomenon that occurs in these centers. Those of us who have operated or attended these centers for some time often recognize these interactions taking place. We exchange knowing glances and smiles of shared hope, our own memories of how we once connected with someone who became important to our recovery. They may have been life changing, maybe even life saving. This is what it's all about. How can we put a price tag on the hopeless becoming hopeful? How do we put a monetary value on the transfer of inner strength from one human being to another? How do we affix a dollar value to someone in long term recovery, unwittingly encouraging a newly sober and fragile person to stay clean for that day by simply muttering, "Hang in there, it gets better"? I'd like to thank you all for the opportunity to share the many insights from evidence based practices in the science of recovery. And that's pretty much it. I'm open for any questions.
Okay, so we did have a question. Is the opposite of addiction is connection theory widely accepted in the U.S. medical community?
I think that just showing this presentation, hopefully there will be more awareness about it. And I think from if practitioners could just realize that the value of just the science, the evidence base, that science is there. And just as in the video, the rat park connection. I mean, it's pretty amazing that how you have a drug there with the rats, and they didn't even want it if they had all their basic needs met: water, food, everything under the sun for them, if they had if their needs were being met. So that's important to science to know that the opposite of addiction is connection. And just knowing that is a good way for society to help in those regards.
Okay, so it looks like that's it for today. So thank you all for joining us today. Thank you to Ms. Elizabeth Sluder for joining us, helping us discover more about our world. Please join us next week, Wednesday, August 4th at noon, for Developmental and Existential Challenges of Young Adulthood. And that is presented by some providers at CAPS, which is Counseling and Psychological Services at Longwood University. So we're going to have Dr. Maureen Wells-McKay. She's the Dean of Wellbeing. Dr. David Davino, who's a licensed psychologist and licensed professional counselor. And Dr. Jenny Rotalik, she's a licensed clinical psychologist. And again, those are all providers at CAPS at Longwood, and they'll be with us next week. So you can register for next week's talk at smv.org. Each talk is free to attend and is open to the first 300 registrants. Thank you again for joining us today. Until next week, stay safe and stay curious.